Hello everyone, this is Dr. Vivek Loomba here. I'm a pain management physician, and today we are going to talk about managing the cancer patients at home, various do's and don'ts. Now, as we all know, the cancer patients they have a significant time which they spend in the hospitals with various admissions in the hospitals for various chemotherapy and management of so many other things. If they are going to have a surgical procedure, they need admission in the hospital. However, these patients do spend a significant time at home as well. What we are going to focus on today is the time they spend at home and how we can help them. The various do's and don'ts needs to be the things they need to take care of while they are staying at home. During the stay at home, they need the medications as well. Most of the medications are oral pills. They may also be using some patches or sometimes the intravenous medications or intramuscular injections as well. First of all, let's talk about the oral pills, the various do's and don'ts. Now, as we all know, these medications, the most important thing obviously comes is that they need to be stored safely and properly. They should be stored away from kids, pets, and the elderly, so nobody can easily get an access so as to mistakenly take these medications. Another thing is to keep in mind is that these patients may be taking several pills every day, so they may need a pill sorter to make sure they don't miss on any medications. Little diary or a note to remind what medication to take at what time may be very handy and useful as well in some cases. One very important thing to remember is not all medicines can be crushed or cut into pieces. This is especially true for some long-acting pills. So always make sure you check with your doctor or the chemist before you plan to do so. These patients may have swallowing difficulties, because of which the caregivers might think to cut medicine, to break the medicine into two parts or crush it. So please be careful when you do that. Make sure you double check before you do such a thing. Now the next thing is about the injectables. So these patients may need different kind of injectables. They may need intravenous, especially for chemotherapy, or they may need intramuscular injections or subcutaneous injections as well. Whatever injectables they are being used, sterility is to be maintained at any cost. These patients already are immunocompromised, they are at high risk of infections, so we need to take utmost care that we use absolute sterile measures while administering such injectables. The subcutaneous injections, they can be self-administered. However, the intramuscular and intravenous injections need a trained personnel, a nurse or a doctor who should be administering those. Once you're giving those medicines, you got to again make sure that you are giving the right dose and the right time. And in case there's any redness, any rash, any itching, do inform your doctor. It could be some allergic reaction to one of these medications. Now, the next thing to be taken care of is how to discard the medical waste. Don't just throw them in your regular bin. Make sure you make separate bags for discarding the medical waste, and these bags need to be disposed in a proper manner as per the medical waste disposal policy. And this will include the gloves, the IV sets, the empty bottles, the vials from the various injections and all, etc. The other things which patients frequently ask is about the laundry. If the patient's laundry can be washed along with other family members. Of course, we can do that. The laundry of patients can be washed easily. There's absolutely no issues if it is washed with the other family members. Unless it is soiled with feces, with urine, with sweat. In those cases, a separate wash is recommended. And again, it can be dried with the rest of the laundry as well. Another question that I'm frequently asked about is about the toilet use. Of course, these patients can use the same toilet. They can share the toilet with other family members. One caution that is recommended is when they're getting the chemotherapy. In that period, If they are using the same toilet, make sure you close the lid and flush it at least twice. And after every toilet use, wash your hands with soap and water. It is very essential. It cannot be stressed enough to maintain good hygiene, not only for the patients but for the caregivers as well. As I mentioned earlier, these patients are immunocompromised, so they are very easily prone to catch some infections. Make sure you maintain proper hygiene and a good diet, which includes fruits and salad, easily digestible stuff that should be given to these patients. Well, I guess that's all for today. If you guys have any questions, please get in touch. Otherwise, I'll see you next time. Thank you. Take care. Have a good day.